Good day to everyone. We are from Group 5 and we will be presenting regarding personality disorder. Okay, now let's discuss about the overview of personality disorders. People with personality disorders usually have chronic interpersonal difficulties and they have a problem with identity or sense of self. And most of the time they are unable to function adequately. There is an enduring pattern of behavior which is persuasive and also inflexible but stable across time and of long duration too. And for a person to be diagnosed with personality disorder, they have to experience clinically significant distress or impairment in functioning in at least two of these following areas, which are cognition, affectivity, interpersonal functioning, and also impulse control. And typically, personality disorders can be diagnosed by adolescence or early adulthood. There are three main clusters to categorize the personality disorders. In cluster A, we have paranoid, schizoid, and also schizotypal, whereby in cluster B, we have histrionic, narcissistic, antisocial, and also borderline. Lastly, in cluster C, we have avoidant, dependent, and also obsessive compulsive. Our main topic today is narcissistic personality disorder, and to discuss more in depth, we will be moving on to the poster presentation. Okay, now let's talk about what is narcissistic personality disorder. This disorder usually involves people who have highly inflated opinion of themselves, and there are two subtypes, which are grandiose and also vulnerable narcissism. In grandiose, people with this disorder are aggressive and also dominant, whereby in vulnerable narcissism, people with this disorder have fragile and also unstable self-esteem. And some of the characteristics that are often associated with people of this disorder are they have a constant and intense need of admiration and also attention from others, and they also have a hard time in accepting others' perspective most of the time. Other than that, they also fantasize of outstanding achievements, and they are unable to maintain interpersonal relationships because they lack empathy and also have a hard time in understanding others' desires, subjective experience, and also feelings. Lastly, they frequently are envious of others, or they believe that others are envious of them. And that is all from me. Thank you.
Hi everyone, I'm Shmy and I'll be presenting the therapy and causes. What therapy we can give to a patient with narcissistic personality disorder? We have 6 therapy here, which are psychotherapy, that is a form of talk therapy, cognitive behavioral therapy, which can help to identify the unhealthy patterns of thoughts and behaviors and replace them with healthy ones. Schema therapy, which combine the elements of psychotherapy and cognitive behavioral therapy. Mentalization-based therapy that work on improving the ability to reflect ourselves. Transference-focused psychotherapy that will help the patients to gain insights to their thoughts and feelings. Analytical behavioral therapy that focus on mindfulness, emotional regulations, distress tolerance, and interpersonal effectiveness. Next, what are the causes of narcissistic personality disorder? They are childhood abuse or neglect, unrealistic expectations from parents, sexual promiscuity, and excessive parental pampering. From this, we can say that parents play the main role in influencing their children's personalities. That's all from me, and I will pass to the next presenter. Thank you.
Assalamualaikum and hi, my name is Nabila Nasri, and today I'll be presenting about how you can spot a person that suffers from NPD. Here we are talking about narcissistic personality disorder. So basically, they have to acquire what they want and they can take advantage of others. Second, they believe themselves as superior and can only associate themselves with those who are equally exceptional with them, and persons who they perceived as inferior and are belittled or looked down on. The third one is they expect preferential treatment and slavish adherence to their demands. The fourth one is they demand the best of everything, such as the nicest car, the nicest office, and so on. The fifth one, they expect to be regarded as superior even if they haven't achieved anything to merit it. And the last one is basically they come appear as pompous and boastful and pretentious if they act arrogant or haughty.
I present the overview of case study. Mark, a 40-year-old man, was the only child and grew up in a divorced family. He lived with his mother, had little contact with his father that made him feel incapable and insignificant as a person. His maternal grandfather provided a meaningful and profoundly supportive relationship to him. At the age of 14, he experienced abuse and used self-defense to explain the action of repeatedly hitting his mother. The latter suffered from chronic exhaustion, depression, and chronic alcohol dependency. Since that, he lived in a boys' boarding school until adulthood. During this year, he was very withdrawn and had very few social contacts. He blamed his stepmother for separation from his mother and still resent his intrusion in his life. In early adulthood, he lived with a teammate family. This situation helped him to open up and feel more comfortable with himself, but still feel difficult to make a commitment to a woman. Only at the age of 30, he married Linda, who is his savior, to make him commit an intimate relationship. Later on, there was a conflict with his wife and also at work where he yelled at the female client over minor argument. And the client described Mark as domineering and cold during interaction. So he sought counseling for better marital issues as well as issues with anger, anxiety, depression, and impulsivity.
So from the case study, we can see a few clinical features that Mark went through. So we can see it in his early childhood, we can see it in his early adulthood, marriage life, and during therapy. So during his early childhood, he had psychological neglect, he went through psychological abuse and also physical assault. During his early adulthood, he felt worthless as a person and he found it difficult to commit to a woman. During his marriage life, he had anxiety, depression, he also had rage, and during his working life also he belittled his client during a conflict. And during therapy, he was reluctant to get help and he was in control during therapy, and he criticizes the therapist and her approach to help Mark.
Okay, now let's look at some of the scenes that are relevant to our topic from this case study. The first scene is when Mark had trouble forming interpersonal relationships and also had a hard time making commitments with other women before he got married. The second scene is when Mark had no friends at all and avoided social interaction at all costs during his early childhood. And next we also have a scene where Mark started having problems with his wife and also his daughter when he couldn't even stand the smallest of mistakes, such as his daughter pushing down a cup of water on the table. The fourth scene that shows relevancy to our topic from this case study is when Mark assumed that he was the person in charge at his workplace and felt the overwhelming need to be a flawless employee, which cost him lots of trouble at workplace later on. And lastly, we have the scene where Mark first started therapy and he started criticizing the therapist and also the therapeutic settings because he just felt like it was not good enough. And that is all from me. Thank you very much.
Next, I'll present about the factors that associate NPD. For your information, the real reason that caused the development of NPD is still unknown. It's probably because of the genetic factors, environmental factors, and so on. In this case study, we are most focused on the environmental factors, which are childhood neglect and trauma due to child abuse. For the childhood neglect, Mark comes from a diverse family. He has little contact with his father and made himself feel being abandoned entirely and think that he is an incapable and inconspicuous person. The coolness and the neglect parenting style of his father has stunted his normal narcissistic self-development. According to Hayes Cohut, a psychodynamic theorist, stated we have two dimensions of normal narcissistic self-development, which are grandiose exhibitionism and idealization. Mark failed to internalize the structuring object that consists of ideal self. The insufficient mirror of ideal self creates the vulnerability in self-esteem. So the normal narcissistic self-development of Mark is stuck, and his grandiose self will continue in adulthood, as there is no validation about his ideal self from his father to fulfill his grandiose desires. Besides, one has experienced traumatic event is also one of the factors that cause the NPD, as trauma left a void, an intense interior state that will jeopardize the self-continuity, coherence, stability, and well-being, and then will activate the self-regulatory to protect self. Mark experienced the abuse by his mother. This trauma made him create armors around his self and being withdrawal to avoid social contact. When he was separated from his mother, he had to stay in the boarding school because he think that social distancing will keep his self safe from the pain and separation. Besides, trauma also triggered the development of narcissistic response like the devaluation, entitlement, and blaming others. For example, Mark's protective narcissistic shares was stimulated during child abuse by hitting back his mother repeatedly. Besides, he also blamed his stepmother is the one who caused the separation with his mother, and also the marital problem is also due to his wife, Linda, instead of him. Lastly, trauma impairs self-esteem, and the vulnerability in self-esteem made him hypersensitive to the criticism, as the criticisms will cause him overwhelmed with the feeling of humiliated, discredited, and horror. So Mark yelled at his female client over the minor disagreement to protect his fragile self. That's all for me. Thank you.
Based on the case study, Mark undergoes a 7 sessions pre-therapy process. During the process, there are several assessment and procedures being carried out to assess Mark's problems and respond to his requests, such as plan analysis and mother principle. These 7 sections did not aim to solve the core problems, but hope to define the problems clearly to help the patients in their later therapy. The present study clarified how plan analysis and movie-oriented psychotherapeutic relationship may influence the therapeutic intervention choice, intervention start, and timing of interventions. The therapist used the information and understanding from plan analysis to give reassuring comments to Mark. Also, the sets of interventions related to mother principles will make the patient feel less defensive and raise motivations for change. Plan analysis focuses on the perspective of behaviors and experience, the meaning of several behavior and experience of a particular person. In certain situations, cannot be determined in the same way. In plan analysis, the same behavior may relate to different plans among persons. Plan analysis helps the conceptualization of the case by showing that Mark is presenting himself as an intelligent person. Mark avoids taking responsibility and talking about his effective life. This behavior and plans may be related to the maintenance of control and a positive image. Also, Mark's behavior, which sits laid back and looks relaxed, serves the plans that presenting himself as a cool and at the same time as making sure the therapist is on his side. This behavior related to the desire of the patients to control the therapeutic relationship and the basic needs of seeking closeness with someone. Besides that, the therapist will conduct the plan structure at the beginning of the therapy in order to establish a movie-oriented therapeutic relationship, which is the mother. This relationship is one of the crucial steps because it will do productive therapeutic work after this. Mother principles can help to analyze that Mark is a good father and also a good employee. The therapy may assure Mark with safety in the therapeutic relationship that he should let the therapist know if he feeling not comfortable or losing control. Besides that, the therapist will always be there for him and give him a response with non-verbal communication such as head nodding. That's all from me. I'll be passed to the next presenter. Thank you.
Lastly, I'll be explaining about the description of the case study based on the DSM-5. So there are basically 5 criterion from the DSM-5 that matches the case study here. So the first one is basically criterion 2, which claims that NPD patients are frequently fixated with the dreams of limitless success, power, brilliance, attractiveness, or ideal love. So this can be seen when Mark married his present wife Linda when he was only 30 years old, and he referred to her as his psychological savior who helped him commit to a deep intimate relationships. So the next one is basically criterion 3, which claims that NPD patients or people who suffer with NPD believe they are superior, special, or unique, and they expect others to notice. So this can be seen when Mark was recently in charge of the company's large team, and conflicts between Mark and one of his clients have recently surfaced. So the third one is basically criterion 4, which states that NPD patients require a lot of admiration. Their self-esteem is always very shaky. So this can be seen during therapy where Mark's interpersonal approach when interacting with a therapist is described as laid back, friendly, in control, and in command of his life. So this shows that Mark wants to show his therapist that he's doing great, even after being forced to do therapy because of the fights he had with his wife. So the next one is basically criterion 7, which claims that NPD people who suffer from NPD lack empathy and have a hard time understanding others' desires, subjective experiences, and feelings. So this can be seen during therapy where Mark opened up to his therapist that he was enraged when his 5-year-old daughter Michelle spills a glass of water on the tablecloth, leaving a watermark. And the last one is basically criterion 9, which claims that people who suffer from NPD are basically characterized by arrogant, haughty behavior, as well as snobbish, dismissive, or patronizing attitudes. So this can be seen in 2 instances. The first one is during therapy where Mark quickly criticizes the therapist and the therapeutic settings. And the second one was when a confrontation between Mark and his client happened during work because he felt like he was disregarded by his client. So that's all from me and from group 5. Thank you.